Hi, my name is Natalie Aguilar. I am a certified personal trainer and a pre and postnatal exercise specialist. Today, we are going to be discussing the best exercises that you should be choosing to perform during your pregnancy experience as well as throughout your postpartum recovery. This is going to go so much far beyond what is considered pregnancy safe exercises and focusing on exercises that are going to optimize your pregnancy experience. What that is going to do is focusing on exercises that will manage the changes that happen to your body during pregnancy, as well as preparing you for labor, and then of course, preparing you to perform the daily tasks of being a parent after the baby is born and on the outside, because your body and your core is in a compromised position, and taking care of a newborn baby or even a toddler, if you already have one, comes with many physical challenges when you're already in a physically compromised position. So we want to prepare your body to recover fast and be able to perform those daily tasks with the most efficiency and reduced pain. So we need to discuss the changes that happen to the body during pregnancy. There are so many changes to look at, but for the sake of this video, we're going to focus on the three main changes that will translate into how you train during pregnancy. The first change is that the hormone relaxin will be released into your body in order to help your body adjust to the growing baby inside of it. Your hips will need to expand. You'll need to have a wider range to make that birth canal wide enough for that baby to come out. So therefore, your body is releasing relaxin in order for those joints to loosen up and make room for that baby. That can come with pain in the hips as well as just other joints in your body, because relaxin does not go just to one single point. It can go throughout your whole body, and many pregnant people can experience this to a severe degree, and some may not notice it that much. Second, when you are pregnant, there's going to be a lot of changes in your alignment of your body. Typical neutral alignment is going to look like your ears stacked over your shoulders, stacked over your hips, stacked over your ankles, and then focusing on having a neutral pelvis and not a posterior or anterior pelvic tilt. When we have a growing baby inside of us, a lot of times our hips tend to open up or lean back and go into an anterior pelvic tilt. This can cause a lot of symptomatic pain, fatigue, muscle fatigue, tightness. And so we want to train in a way in order to manage those alignment shifts. Thirdly, it's also very common and very normal for us to gain weight during pregnancy. This extra weight can be a burden on your body as it is trying to adjust to the alignment shifts and the new baby growing inside of it, as well as just having more weight on your body. If you're not training properly, your body may not be increasing in strength in order to be managing this additional weight that is going onto your body. So we want to make sure that we are strengthening the muscles to be able to control and manage this additional weight that we are getting during pregnancy. Therefore, one of the most important training modalities to focus on during pregnancy is strength training. Performing strength training during pregnancy is going to allow us to keep up the strength in our body as well as possibly get stronger. So instead of being at our heaviest weight and being at our weakest strength-wise, we can therefore be at our heaviest weight and also our strongest, so we can keep up with that and not have the aches and pains that go along with having weaker muscles trying to carry a heavier body. Also, focusing on exercises that will keep our body in that neutral alignment in order to cope with the changes of that, because we can experience a lot of muscle fatigue and pain and soreness when we are out of neutral alignment. So we want to train muscles that are going to support neutral alignment, mainly focusing on the glutes and the core. Another huge benefit of focusing on strength training during pregnancy is that not only are we strengthening the muscles, we're also strengthening the joints and the connective tissue, which will help you manage the effects of relaxin going through your body, so that even though you're having that increase in mobility through relaxin being released through your body, you're also keeping up your strength in order to go along with that increased mobility and not experiencing as much pain through that range of motion being increased. When thinking about what specific exercises we want to choose to perform during pregnancy, you want to be very intentional with that. We want to choose exercises that are going to support neutral alignment, keeping those shoulders stacked over the hips and the pelvis in a neutral position, mainly focusing on the glutes and the core function with that. We want to switch core to anti-core movements. So instead of working the core to be out of neutral alignment, we are actually going to load it where it will be pulling us to be out of neutral alignment and resisting that. Therefore, focusing on stabilizing the core in that way. We also want to choose exercises that will increase our strength and our efficiency in performing daily tasks while we are pregnant, because we are once again dealing with an additional weight. And then going into postpartum, when we have the compromised core, the compromised physical condition, and still having to perform those very physically demanding tasks with a little 8-pound live dumbbell. So now getting into the exercise selection. First, we want to make sure that we are finding neutral alignment, that you know what that is for your body. I am going to be linking a video at the end of this that will help you to find your neutral alignment. And you want to apply that neutral alignment into every move that you do. Exercise inside the workout, as well as your daily life, going around, walking, grocery shopping, going out with friends, things like that. 2, we want to make sure we are optimizing core function, which will focus on the whole core canister right down to our breathing. So there are 2 main exercises that we will be focusing on with that, the 360 breathing and pelvic floor activations. There's so much to go along with that, so that is going to be in another video as well. And 3, focusing on the fundamental movements. This is where it comes to the traditional workout that you would be looking at. Fundamental movements for prenatal, postpartum, and life in general are going to be the squat, the lunge, the hinge, the upper body push, upper body pull, rotation of the body, because we are not always just moving in one plane of motion. Carrying, especially important for a new parent. You're going to be carrying a diaper bag, carrying a car seat, carrying your baby on the side of your hip. We need to get very good at maintaining a neutral alignment with this additional weight to be carried around. And of course, making sure we're sprinkling in some anti-core movements into all of that in order to spice it up and advance it a little bit. These are the moves that you should be focusing on in your workout and making sure that you're getting stronger in those movements. These movements are going to be done daily throughout your day. Just as you're going around, you're getting down and up from the couch, you're walking around to get lunch, you're picking things up and putting them on the counter. These are moves that are just part of our functional life. And performing these moves in your workout will allow you to be stronger at them in your daily life and reduce pain while doing so. These movements are going to strengthen your body to manage the changes that happen during pregnancy, facilitate an easier and more efficient labor, and also faster recovery after birth, and be able to perform those daily tasks after birth. So if you're interested in a breakdown of like a workout example, including those moves, feel free to comment and I will know that I need to prioritize putting that out next. But in the meantime, feel free to check out my other videos about 360 breathing, neutral alignment, pelvic floor activations, and anti-core movements. I hope you enjoy this video and that this knowledge will help you have a better pregnancy experience.